While the United States has been in an opioid crisis for years, Nebraska has not been hit as hard, ranking last in overdoses by the CDC. Still, the federal government has given Nebraska funds to fight the epidemic. The state has armed first responders with the medication Narcan to prevent overdoses. Now, reporter John Kipper tells us they're taking the next step, offering the medication for free.
Like a life jacket, like a safety vest. We hope you never have to use it, but we want it to be available.
With the rise of opioid overdoses, this drug, naloxone, better known as Narcan, is becoming an essential tool in a first aid kit. And now any Nebraska resident can get it confidentially at no cost.
They are able to go get that and have that on hand, and it's a nice peace of mind. It's not a cure-all, it's not a fix-all, and it's definitely not endorsing somebody to go use drugs.
Before the program started this week, anybody in the state could walk up to a pharmacy and get a prescription for Narcan, but the cost is burdensome, with each kit going for about $120 a piece.
It's expensive. And when we remove that barrier, I'm hoping that we'll be able to get more Narcan into the hands of people who need it.
The pilot program is designed for anybody, whether it be an opioid user, loved one, or caregiver, to get the nasal spray. And if an overdose begins, they can use the spray and then call 911.
This is just going to help, hopefully, give first responders more time to get there and take care of that person.
Now, right now you can pick up the Narcan in one of 3 locations, and that includes Kohl's Pharmacy in Lincoln. But eventually, they hope the program goes statewide.
So right now, while you have to go to Lincoln or Auburn to get Narcan, that could change soon.
Our hope is to gather some data from these 3 sites, how that's working, what does work, what doesn't work, and eventually take that statewide into other pharmacies that want to participate as well.
In other states, some have raised concerns that opioid users are more likely to use if Narcan is nearby. But Lindsay Hanlon with Nebraska Health and Human Services isn't buying it.
It actually doesn't show that it increases the use of opioids any more than if they weren't to have it. So really, we just try and use it as a protective factor.
Reporting in Lincoln, John Kipper, 3 News Now.
Iowa recently started a program that will mail Narcan to anybody that needs it after a video consultation with a pharmacist.